Hi everyone, my name is Dr. Darcy Banco, and I'm an internal medicine resident at NYU Langone Bellevue Hospital in New York City. At ACC.21, I'll be presenting our poster titled Sex Differences in the Evaluation and Management of Young Adults Presenting to the Emergency Room with Chest Pain. So in terms of the background of our study, recent data has shown that heart attacks are rising among young adults, and particularly young women. What we also know is that compared to young women, after a heart attack, young women have worse outcomes both in terms of mortality and quality of life. Chest pain is the most common symptom of heart attack, but when young adults with heart attack were interviewed, they were asked the question, when you first went for help, did the healthcare provider think that there was something wrong with your heart? And women were more likely to answer no to that question. And so therefore, we designed our study to answer the question, when presenting to the emergency room with chest pain, were young women and young men treated differently? To answer this question, we use a CDC database titled the National Hospital Ambulatory Medical Care Survey. This is a yearly survey that's conducted by the CDC to produce national estimates of emergency room care across the United States. What we found is that compared to young men, young women were less likely to be triaged as emergent, they waited longer to be seen by a provider, they were less likely to undergo ECG testing or to be seen by a consultant, and were subsequently less likely to be admitted to the hospital or to an observation unit. After multivariable adjustment, we found that young women waited on average 10 minutes longer compared to their male counterparts, and were 40% less likely to be admitted to the hospital or to an observation unit. So in summary, what we found is that when presenting to the emergency room with chest pain, young women were treated differently than young men. I think that what this means is when interacting with patients who are experiencing chest pain, as healthcare providers, we should keep in mind the changing demographics of heart attack towards more young adults and particularly young women. And I think we always need to keep in mind heart attack as a potential diagnosis or explanation when someone's presenting with chest pain. I think that there needs to be future research to investigate whether the differences that we observed in our study are related to differences in outcomes that were observed in previous studies. And most importantly, I think that we should continue to investigate how to better diagnose and treat heart attack in young adults, but particularly young women, because they often present with unique types of myocardial infarctions and have unique risk factors, such as hypertensive diseases of pregnancy, autoimmune disorders, and mental health disorders. And these unique risk factors are not incorporated into commonly used risk stratification tools, although they do increase women's risk of heart attack. Refocus, reconnect, and reimagine at ACC21.